pay for health care or whether to have universal health care. A U.S. study predicted that the Patient Protection and Affordable Care Act, Obamacare, would save the American government $109 billion between 2012 and 2022. That sounds like a big number. $109 billion over 10 years, or around $10 billion per year, until you realize that diabetes and prediabetes cost Americans $322 billion in 2012. $78 billion of that was lost productivity. The remaining $244 billion was for excess medical costs. That is, costs not otherwise incurred if people didn't have diabetes or prediabetes in the first place. Big numbers are hard to digest. Here's another way to view that $322 billion. On average, diabetes costs every single American about $1,000 a year. Even worse, between 2007 and 2012, the cost of diabetes in America rose 48%. And while we are talking about the personal cost of diabetes, there's another issue. As Rubin points out in this book, many people have no idea what diabetes really means. They receive the diagnosis and simply accept it as a life sentence and wonder which medications they will require. A lifelong relationship with medication, whether pills or injections, is the smallest tip of the consequence iceberg when it comes to type 2 diabetes. If you or anyone you know are currently living with type 2 diabetes or prediabetes, it is incredibly important to know what that means. Perhaps you know that pre- and type 2 diabetes means that your body is no longer processing sugar efficiently or effectively, either because your body is resisting insulin or not producing enough. On the surface, this seems fairly innocuous. Surely there is a medication that can sort this out. Medication can help reduce blood sugar and future complications such as nerve damage, kidney damage, heart and blood vessel disease, Alzheimer's, eye damage, and early death, but it does not eliminate them. The only thing that can do that is to reverse type 2 diabetes with food and exercise. If you are concerned about or are living with type 2 diabetes, please buy another copy of this book and give it to your doctor. Type 2 diabetes should no longer be seen as a chronic disease, but rather an injury from which you can recover. Dr. Ruiz and Eric have done an excellent job making this argument, and they have provided an effective step-by-step program for becoming post-diabetic. Don't just listen to this book. Listen to it, follow the steps, and then pass it on to someone else who needs to know. Mark Hyman, MD, Head of Strategy and Innovation, Cleveland Clinic Center for Functional Medicine. New York Times best-selling author of Food, What the Heck Should I Eat?
Introduction by Ruben Ruiz. Introducing Ruben Ruiz, MD. Early one afternoon in 2015, I pulled onto the I-10 freeway in Los Angeles. Man, was I tired. I tucked my second Starbucks Grande coffee of the day into the car's cup holder. I felt tired a lot back then. I was sleepy all the time, drinking coffee like crazy just to stay alert. Those days, I never felt that great, but figured that's just what getting older meant. Over the years, the needle on the scale had crept up from 160 pounds to 250. Gaining 90 pounds didn't happen overnight. It was imperceptible from day to day. Other things about my health were slipping too. I had high blood pressure, another problem that had slowly crept up on me. I had developed sleep apnea and didn't sleep well. My cholesterol, triglycerides, and hemoglobin A1C blood sugar measurements were all up. In the course of a decade, my health had deteriorated to the point that I was on 10 medications, apparently forever. I had signed up to be a healer, and I couldn't even heal myself. I was on metformin, 500 milligrams twice daily for diabetes, trimeterine and Maxide, 75 and 50 milligrams daily for severe hypertension and early heart failure, Coreg, 25 milligrams twice daily for severe hypertension and early heart failure and palpitations, Lipitor, 40 milligrams daily for dyslipidemia,